I would like to talk a little bit about who makes a better candidate for FUE, or follicular unit excision, versus FUT, follicular unit transplantation, also known as strip procedure. Some patients who come in are going to be better candidates for one over the other, or they might be good candidates for both. The FUT procedure does cost a little bit less than a robotic FUE procedure, so that may be one factor involved. People who have a limited donor hair area may be a better candidate for FUT, especially if they need a lot of coverage, because you can get more grafts out from a strip procedure versus an FUE procedure on the first try. A younger patient who may be just at the beginning of their hair loss is going to be a better candidate for FUE. When aesthetics come into play and people, for whatever reason, don't want to trim their hair in the back and on the top, a strip procedure or FUT will be the best option, because we can just trim the hair in the back that needs to be taken out as part of the strip and leave everything else long. So they would actually leave the office pretty much looking the same way as when they walked in.